kind of question. The U.S. military has been very interested in this question because I looked at suicidal behavior in active duty. And they have a problem with suicides, and they know that if they want to improve and reduce suicides, they have to impact this high-risk behavior. These folks with violent crimes, commingling behaviors, alcohol problems. They want to know, what can we do to intervene here? So for general health, I can tell them that 30 international scientific and government bodies already recommend increasing omega-3 fatty acid intakes to fish 2 to 3 times a week or a gram a day. The US government in 2010 dietary guidelines. It's on the basis of about 90,000 basic science publications, almost 10,000 human studies, and about 2,000 clinical trials. Very robust. But what about for high-risk behaviors? What do we know about major depression, substance use, violence, and suicidal behavior? So here's a summary. Here's major depression. I showed you some of the epidemiology and changes. I didn't show you the randomized placebo-controlled trials. This meta-analysis thing means we took a sum of all the randomized placebo-controlled trials and statistically combined them to see if they really work and if it's just variance or if it's solid. Yes, there's a large effect for major depression, which I cut my teeth on in this field. I believe the effect of omega-3 fatty acids in the trials that are done right are bigger than pharmaceutical antidepressants for treating major depression. ADHD, there's 10 randomized trials, 1 meta-analysis. Yes, it's quite effective. It is not as effective as Ritalin and stimulants. Aggression and violence, I described to you a little bit about. Anxiety is kind of hopeful. Alcohol and substance use, we're working on it, and I'll tell you a little bit about suicide and the Bravo study. Here were data derived from this observation of omega-3 levels in the US military. We looked at 800 people who died from suicide and rescued their blood from the freezer in Silver Spring, Maryland. Compared it to the blood of 800 who were matched controls. First thing we found is that everybody's blood levels were pitifully, terribly low in omega-3 fatty acids in the military. We think that, this is, if you're following a Mediterranean diet, you want to be about here, 50-50 omega-3s to omega-6s. And if you want optimal health, like old guys in Japan or Key West, then you probably want to be 70% there. Too lazy to go anywhere, just fish all day. So everybody was there. So we have an observation that omega-3s are low. We're assessing this in a grant. Bernadette Mariota is my co-PI at MUSC, a randomized placebo-controlled trial. We actually are starting enrollment now in March 2014. We're using this Norwegian product again because it's convenient and it's not capsules. 3 grams a day versus a placebo. We're enrolling US military veterans who have a high risk of suicidal behaviors, either a suicide attempt or these problems, and we're assessing them for 6 months, and I'll come back to you in 2.5 to 3 years and tell you the results. We did this on the basis of a small, also a pilot trial where we looked at the effect of omega-3 fatty acids in 49 subjects who were in an emergency room in Dublin, Ireland with deliberate self-harm. For 12 weeks, we either gave them 2 grams a day of omega-3s or a placebo. We saw a 50% reduction in depression, a 45% reduction in suicidal thinking, a 33% reduction in the perception of stress, and a 30% improvement in happiness measures, which I really like. So here's a little bit more data on suicide to sort of lead you into the next part of the talk. These were data on omega-3 fatty acids from patients who were in the hospital here with